postpartum visit is a great time to do a test for not only thyroid, but also for ferritin to see if you've recovered iron. During pregnancy, a lot of the micronutrients and macronutrients as well are depleted. So you don't want to be in a state of micronutrient or vitamin deficiency and starvation, because your body may consume unnecessarily more macronutrients trying to find those nutrients. So 6-week postpartum visit, a great time to do that. The confirmed pregnancy test, much more before the initial 12-week visit. But as soon as you confirm, that is another great time to get a full thyroid panel and look at iron homeostasis as well, and to get a urinalysis, not to go too far off topic. But if you're thinking about your most common reasons for miscarriage, luteal phase defect and NK cell hyperplasia are not necessarily the most common. If there's 3 or 4 or 5 miscarriages, maybe you look at more like antiphospholipid antibody syndromes or like lupus anticoagulant. But your main 2 are really asymptomatic bacteria, where there's bacteria in the urine and the bladder, or hypothyroidism is a very common cause of miscarriage as well.
And infertility in general. People are always asking about, what do you need to do before you, or to optimize fertility before you conceive. And I've heard it time and time again from patients. It's like, yep, I got started on thyroid hormone and then I got pregnant. So that doesn't mean that if you're having trouble getting pregnant to take thyroid hormone, but it could be part of what is contributing to that. And the way to find out is to get tested.
Yep. There's a lot more than just a low dose of Clomid or letrozole and a progesterone at the end of the cycle. There's many, many other things: bromocriptine, cabergoline, controlling prolactin, controlling thyroid hormone, modulating SHBG, insulin sensitivity. So there's a lot of other things to think about. So just like, you shouldn't just empirically start a regimen. You should get labs, look at the objective data, look extensively at the history, and then come up with a good plan. It's also pretty common for, again, not to delve too far off topic, get your HSG, which is basically dye that's shot through the uterus and the fallopian tubes. Well, 1, just to make sure that there's no structural defect, and then 2, it does kind of clean out the pipes. And a lot of times you have pregnancies or chemical pregnancies, or you have conception happening, but there's still something else that needs identified via your team of professionals.
Yeah, I think those are really important points, and I think there'll be a subset of listeners that can really look into some of those things if they are struggling with fertility. I think most people would stand to do very well just by optimizing their diets, getting their metabolic health optimized, and then having a preconception visit.